Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, a neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I'm also the medical author of the two books Focus Neurology and Exam Oriented Clinical Neurology. We are continuing with the neuroimaging concepts. We are talking about spinal cord disorders. So in this episode, we'll talk about neoplastic disorders of the spinal cord. The neoplastic disorders of the spinal cord. So neuroimaging concepts, part 38, spinal cord disorders, part 6, neoplastic disorders. The neoplastic disorders of the spinal cord could be primary or metastatic, that is spread from the other areas. The primary central nervous system neoplastic disorders are extradural, that is outside the dura mater, or intradural and extramedullary, that is inside the dura but outside the spinal cord, classically neurofibroma or meningioma, and third intramedullary, that is coming from inside the spinal cord. So the neoplastic disorders could be divided into extradural, coming completely from the outside of the spinal cord, that means bone and the periphery of the spinal cord, or intradural extramedullary, that means inside the dura mater but outside the spinal cord, that means usually the neurofibroma or meningioma, and third intramedullary, coming from within the spinal cord. So these are the neoplastic disorders: extradural, intradural extramedullary, and third intramedullary. We have metastatic disorders of the spinal cord coming from elsewhere. One of the common sites which tends to metastasize to spinal cord are lung, breast, and prostate. So lung, breast, and prostate are the common sites from which the neoplasm metastases to the spinal cord. So here you can see this meningioma. Here you can see this meningioma. The sagittal, this is the axial cut. So here you can see MRI of an intraspinal meningioma that is displaced and compressing the spinal cord. You can see it may cause incontinence and leg weakness, but here you can see there's a homogeneous enhancement, very characteristic. See, everything is hyper intense. So this homogeneous contrast enhancement is very characteristic of meningioma. And second thing, since it's coming from the, it comes like this, there's usually a dural tail. So you can see the dural attachment here. So these two features are very characteristic of meningioma. One is the homogeneous contrast enhancement, and second is the dural attachment or dural tail. These are the concepts of the neoplastic disorders of the spinal cord. Hope you have enjoyed it. The other important concepts of clinical neurology I put in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas, published by White Army Publication. This book will be very useful for students appearing for clinical neurology exam. The other book I've written is Focus Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. All the important theoretical points of neurology I put in a question and answer format in this book. This book will be very useful for students appearing for the Viva or oral exam. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts on neoplastic disorders of the spinal cord. If you have enjoyed it, please like and share the link. But please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology education YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.